Well, Advocate Healthcare is launching a new virtual program to help COVID-19 patients at home all around Illinois. It's called the We Got You campaign.
And Dr. Session Dixit of Advocate Medical Group is joining us now to discuss this program. Doctor, thank you so much for joining us.
Thank you for having me.
Who qualifies for this and how do they get involved?
So basically, any Illinois resident qualifies for this program. And the way to get enrolled in the program would be patient can self-enroll by calling our COVID-19 hotline. You can also go to advocateaurorahealth.org website and get enrolled and get more information. You can also go to aah.org/WeGotYou campaign and get more information as well.
Doctor, can you give us an idea of what some of the hallmarks of the program involve? Like, what is the outreach? What can people who need those services, what can they expect to get?
Thank you. So the way the program is structured is that it is actually free to all residents in Illinois, regardless of their ability to have an insurance or not. It is available to any residents, regardless of whether they are patients of Advocate Aurora Health or not. The way it is structured is that patient would, it offers medical education, symptom checking, 24/7 support virtually via mobile app or through the website for a period of 14 days. Eligible patients would also receive a free medical kit if they need it, which would include a thermometer, a blood pressure cuff, and machine, pulse oximeter, and mask as well.
Now, doctor, is this all virtual or are people able to, we're seeing video of people getting haircuts and getting their nails done and things like this. Is someone there to help them do all these things or is it all virtual?
It is all virtual, actually. We know that because of the pandemic and the issues that comes with quarantine, we cannot have a lot of patients seen in person, physically in the offices. And so we had to create a pathway for these patients to stay connected with our healthcare team members to meet their healthcare demands. And that's why it's all virtual.
At what point would somebody consider reaching out to the We Got You campaign? Is it after they get a test? Is it if they've been exposed to somebody with symptoms, they're feeling symptoms? When is a good time to reach out?
So anytime, whenever a patient experiences symptoms which are COVID-like symptoms, if the patient has been diagnosed with COVID and told to stay home, if a patient has been under investigation for COVID and waiting for the COVID test results to come back, those would be the times that a patient can reach out to us and we can get them enrolled in the program and stay connected and go through the program.
And what about,
the way it works is that patient has to get their vitals and symptom checker. Our team members virtually monitor those symptoms and vitals, and based on those alerts, there would be an opportunity for our team members and clinicians to stay connected with them via virtual video visits or via phone.
And if you don't have a computer, would a smartphone work or just a call on the telephone?
You can, you need a computer or a smartphone. If you don't have that, we have partnered with our pandemic health workers who can make those tablets available to our patients who get enrolled in the program overnight. So we want to try to address as many needs as possible for those patients to not get out of the house and stay quarantined during those 14 days.
Great idea. Thank you so much, doctor.
Thank you.
Be safe, be well.